Welcome back, guys. The first thing I want to share today are the different roles in the field of mental health. A lot of my clients have expressed frustration and confusion when trying to find a therapist. There's a difference between titles and credentials and the roles and the functions of the different professionals in mental health and paraprofessionals. Um, so many of the different titles and roles they're all essentially the same when it comes to therapy. They do the same thing, but they vary. They vary from licensure, codes of ethics from state to state. But all therapists assess, diagnose, and create intervention plans. So the terms therapist and counselor are often used interchangeably or loosely, but they're essentially the same thing. A counselor does therapy, a therapist does counseling. Oftentimes, individuals don't understand the difference though between a counselor, therapist, psychiatrist, etc. So some clarity. Uh, it's not. This isn't the absolute list of the different titles and roles, but some of the more common things you're going to hear or titles you're going to hear. Um, Clinical social worker. That's my degree. Um, so a master's in clinical social worker or in clinical social work is what you need to be a therapist. One of the many degrees. There's marriage and family therapy. There's licensed professional counseling. Um, those are the most common ones. Psychologists. That's a master's or a PhD in psychology. Any one of these degrees, you can go for your PhD. It's not going to really get you any more money. It's not as far as educational. If you're looking for a therapist, what do they specialize in? That's what you're going to want to look. If you're seeking a trauma therapist, you're probably not going to look for a marriage and family therapist. Um, a lot of the therapists do a lot of different types of therapy too. Most of them can do substance use counseling if they're educated in it and they know about it. They don't need that professional certification for addictions. If they hold a bachelor's degree in, say, social work or psychology, you may work for an agency, or you may find a counselor that works for an agency where they have them create a learning plan, and they go for a 3-year course of working and applying these skills before they actually get their professional certification. So, another word you might hear a lot is clinician. A clinician is basically somebody who's qualified to be a therapist that maybe does both paperwork and therapy. Like they'll do case management where it seems like they're a therapist, but they're not. A case manager isn't necessarily a therapist. A lot of those positions are held by bachelor level social workers. Um, but to actually do therapy or to call a person a counselor or a therapist, they have to have a master's degree and licensed in their state. So again, therapists conduct assessments. They diagnose mental health disorders. They take good notes. Well, they're supposed to take good notes for documentation. Um, they help the clients create therapy goals and intervention plans. Therapists generally use a variety of evidence-based models and operate within the scope of their practice and state licensing regulations. Some also perform in administrative roles, own and operate a private practice like I did recently. They might teach, they might write. Um, a lot of different things they might do. So therapists are educated regarding medication therapy, but they don't prescribe medications. If the client and therapist agree that medication is needed, the therapist then may refer the client to a psychiatrist, or sometimes the family doctor if it's something minor, like mild depression. Um, so mental health therapists are not peer support specialists. Peer support specialists feel like a counselor and often have sound advice. It's because they've not only experienced what they're helping their clients work through, but they were able to heal and thrive again. They inspire their clients and they give them hope. This is an entry level position in the mental health field that sometimes and often does not require formal education. Sometimes in some roles, but oftentimes it just requires that the person has been a part of the population that they're serving now. Addictions counselors, so this requires a bachelor's or master's degree. Um, and some additional certifications like a CADC or so if you have a bachelor's degree, you need a CADC. If you have a master's degree, you may or you can or you don't have to have a CAADC. But if you're working for an addictions agency, chances are they're going to require one of those two addiction certifications, whether you've got a master's or a bachelor's degree. But in the state of Michigan, anyway, you do not have to have a CAADC if you're already a licensed therapist. So, advocates. Advocates, they counsel all of the time and all types of different people in all sorts of settings. But it's in the form of navigating a client through a hardship or difficult time. Sometimes they help seek out resources for clients. They provide transportation sometimes, maybe vouchers, and or serve as great listeners. School counselors, generally not a therapist, but a talented school counselor can be very therapeutic to their students if they have the wherewithal. There are generally no evidence-based models that are used or utilized by traditional school counselors unless they are also a licensed therapist or they're following an IEP plan that was set forth by the team of school staff, including a school psychologist. So school counselors are also required to attain specific additional school counselor college credits in addition to the bachelor master's degree requirement. Every element of what I just explained varies from state to state. Guidance counselors. This is similar to your school counselor. They help you with your schedule. Some are good listeners to kids with problems, but they generally refer you to therapy if they feel that you require more intensive help. And same with the school counselor. If they feel that that a kid is needing a lot more help than they can provide, they should be referring them out. Case managers, I just talked a little bit about that. That's in the field of mental health. These are usually bachelor level individuals who are likely working on a master's degree in either social work, psychology, or licensed professional counseling, or marriage and family therapy. They're often mistaken for therapists because they're in the process of learning new therapy practices and may currently be helping clients manage their lives. So they have sound advice. They're often following directives that are ascribed by the therapist, who is sometimes the supervisor for the case manager. It just depends on the agency. Psychiatrists. So a psychiatrist is more than qualified to deliver therapy, but they're pretty much the medicine man. It's a family doctor. They start out as just a family doctor, and then they further their education with more focus on psychiatry. So where they come into play is if somebody needs medication, the therapist or even a case manager or their family doctor would refer them to a psychiatrist, and the psychiatrist would then do all of their assessments. They're different. The psychiatrist assessments are usually more in depth than a therapist assessment. They're all in depth, but the psychiatrist, it may take anywhere from 2 to 4 hours sometimes when you're having a first visit. So there's usually fewer visits to the psychiatrist than the therapist. The therapist, ideally once a week, sometimes once a month, every other month, or once a month or a couple times a month. A psychiatrist, usually no more than once a month, sometimes every 3 months. So the only time I've ever seen a psychiatrist do some therapy is when there was a long waiting list. Sometimes the waiting lists in some areas for psychiatry or even therapy are for several months out or a year. So as you probably, if you're watching this channel, you probably know that there is a shortage of therapists and there's a serious problem. So that's just kind of the rundown on the different roles. If you were wondering about what all of that means and what's the difference, there's some of it. That's not absolute. There's a lot more. It's a never-ending thing. So I hope that helps, and stay tuned for the next segment, which I believe the next topic will be on mindfulness. Thanks, and have a great day.